Okay, hi guys, this is Dr. Tim here with Optimized Wellness Center. Today we're going to be working on an endurance athlete who has fractured her foot. Hi there, Paige.
Hi.
Welcome, glad you're here.
Thank you.
We worked together a couple of times recently, immediately after the fracture, and we're doing some initial analysis and diagnostic stuff, as well as some other interventions and therapies. But I wanted to get a sense from you. What did you feel immediately, and then how have you felt recently since a couple of weeks ago when this injury first occurred?
Initially, when the incident happened, I was taking off from the start line and running up a gradual incline, and it was just incredible pain in this area of my foot. Very sharp, and it was impossible to continue running further. So,
Right. I remember you said that you were kind of hobbling around and really concerned about
yes.
what had happened. And we had the opportunity to meet almost immediately, and we used some diagnostic tools to evaluate that there was both some soft tissue damage and
Yes.
quite likely a fracture in the foot. And if I remember correctly, even the imaging that you had done, the x-ray, initially you were informed that there was no fracture, but subsequently they did identify an occult
Correct.
or hairline fracture, which sometimes doesn't show up immediately on imaging.
Correct.
Okay, got it. So what we're going to do today is progress and further some of the care that we've done before. And so I hope that you guys can see this. What we're working on is this area in the foot here, where unfortunately there's been a fracture within the toe, but it's not a full fracture all the way through the bone, and it's going longitudinally through here. So we're doing both some soft tissue as well as some work on the actual bone itself. In the interim time since the injury, you've been taping the foot consistently and really limiting activity and movements to try and give it the best opportunity to heal. So the first thing we're doing today is we're actually going to be using what's called as a cold laser or photobiomodulation, and that's this device here. And I have preset a specific set of frequencies in here that is going to facilitate the healing after an acute injury. So what we can see is when I shine this, potentially you all can see that there are 4 different diodes here emitting light, and this is what is going to help to heal this. And so you may be able to see the 4 different diodes coming across here. And these specific frequencies that we're using are going to help to, there are a variety of FDA approvals, but the ones that are relevant here for this is pain mitigation, increased range of motion, as well as stimulating a healing process where we can give more energy to the body to enhance that healing. So if I remember correctly, after the last time we met, you'd indicated to me that there was a little bit of reduced swelling, and you've been able to continue doing some more movement with some limitations though. Is that right?
Yes.
That's great. So we want to help the body to be able to heal, and in particular lasers at its very base level, photobiomodulation, photo meaning using light, bio meaning the body or its innate capacities there. Modulation is the ability to be able to change or enhance things in this case. We're using light to stimulate the mitochondria. Maybe you remember in basic science class, every cell has a powerhouse and it's called the mitochondria. And when we stimulate the mitochondria with laser, it upregulates the capacity of that cell to respirate and breathe, just like we as humans breathe. The cells need to breathe, and when that happens, it produces more ATP. And ATP is the unit of energy, just like the energy that comes out of the wall, kilowatts. Well, ATP is the unit of energy inside of every cell. So if we give the cells more energy, we can heal bigger, better, stronger, faster. And the research shows consistently that photobiomodulation, utilizing lasers like we are here, can enhance and expedite the healing process by 20 to 30% in almost all cases. There's no pain, no downtime, no side effects, no incisions, nothing of that nature. So it's really an excellent way to enhance the healing process. So under normal circumstances, we would leave this light here, and potentially we would also be stimulating some other areas of the body for around 15 to 20 minutes to give it a full dosage of this light to upregulate that capacity. But we're going to now transition to some other things, but I just wanted to give you all a quick introduction to using laser light as one of the methods to help heal the body. And in this case, we're stimulating the body's ability to repair and heal a bone fracture. Thanks, guys. This is Dr. Tim with Optimize Wellness Center.